And Dr. Owens, I was wondering, what is sciatica?
Sciatica is a fancy word that describes pain in the back that extends down into the legs. Sciatica is back pain, lower back pain, irritation to the nerves that extends down and shoots down into the legs, one or both sides.
Now, Dr. Owens, I was wondering, is sciatica dangerous? I mean, okay, I got some shooting leg pain. I've actually had it before. Is it dangerous to leave unhandled? Will it just work itself out?
Occasionally, if you just rest it, it will work itself out, at least for a little while. It's a symptom that something underneath is wrong. So it should be treated. Now, is it dangerous in the fact that I need to go get immediate medical attention? Well, here are the cases in which it is that if you are losing bowel or bladder control, you need to see a medical doctor immediately. If you are losing a great deal of muscle mass, in other words, you notice your leg getting smaller, then you need to see a medical doctor immediately. The nerve is compressed most likely beyond the help of a chiropractor. And the last one is if pain is so horrible that you could only, you're going to need morphine or some kind of narcotic to help it, and it doesn't help. That's when it's serious. So, other than that, chiropractic really does a nice job with sciatica. The pain medication that you take over the counter is what's called a non-steroidal anti-inflammatory drug. Those are safe if you use them very short periods of time if the pain is very severe. I always say stay away from them if you can, because these inhibit inflammation. Inflammation is the first step of the healing cascade. So in other words, that starts the healing process. You don't want to stop that right at the beginning. You want your body to heal itself. That's what it's designed to do. Second thing pain medication can do is give you a false sense of security. In other words, you feel like you're doing better and you go out and re-injure yourself that much easier. So I recommend against pain medication in a lot of cases for the very reason that of those things. Now, as a chiropractor, I can't recommend a patient take drugs or not take drugs. It's not in the scope of my practice. For further consultation, of course, see your medical.
Dr. Owens, I was wondering what treatment options are out there that I should consider for back pain or back pain treatment?
There are a lot of options out there. For back pain, a lot of people come to me after they've been to their medical doctor, the physical therapist, and those treatments haven't worked. Those are certainly options. However, with a chiropractor, we try and get to the root cause of the pain, which is usually a bone that has some form of dysfunction. In other words, it's not working correctly. With a chiropractic adjustment, we will locate areas of the spine that are very stiff, that aren't moving correctly, or maybe jammed out of position. And the job is to get them functioning again so that they can flex, so they can move. Physical therapy doesn't address that. Certainly drugs don't affect that. So chiropractic is a great choice. After we do restore the joint dysfunction, physical therapy can be a great option because they're going to do some strengthening exercises. You'll learn that's really what they're really trained for, is the strengthening and rehabilitation of stuff. But you can't do that over top of joint dysfunction. And so that's where chiropractic comes in, I think, as a first.
I was wondering how much bed rest should I get while I'm suffering back pain? If I'm being treated for back pain, how much time should I spend in bed and all that?
As far as bed rest goes, with a serious case of back pain, it's good to probably be off your feet for 1 to 2 days, 3 days, sometimes maybe even more, because we don't want to re-injure, re-tear it while we're doing the adjustments to get things back in place. So it's variable, and during that bed rest period, you want to be icing all the time.
Hi, Dr. Owens. I was wondering, could my work environment be affecting my back pain at all?
Absolutely. Work environments can vary, of course. The one we see here in Bellevue a lot, being close to Microsoft, is the computer posture, where someone is here or looking into the computer all day. The head goes forward. They're sitting all day and they never move. That creates a pretty standard pain here in the shoulder blades, in back, upper back, kind of naggy pain that's always there. And then, of course, they go back to work the next day, and it's there again. So that's very correctable. As far as other work environments, if someone is, any repetitive motion with limited ranges can cause back pain. And our job really at that point is to address how to get them doing other things during the rest of the day. For the computer guys, we might have them stretch their pecs backwards a lot of times during the day because we have to move our body in all directions for it to be pain-free.
All right, Dr. Owens, I have a question here. Are there any symptoms of back pain which indicate a more serious condition or like a disease or anything like that?
There certainly can be serious conditions that cause back pain. If it's something like cancer or a ruptured disc that's beyond help, with cancer you'll tend to get a very hard boring pain, and it doesn't go away no matter what you try. With something like a ruptured disc, it's an extreme pain. The pain will probably be at about a 10 out of a 10 on a pain scale.
Wow.
It will be intense, so intense, in fact, that you're thinking that you need to be at a hospital for morphine right now. There can be degrees of these conditions, and that's why it's never bad to go get opinions from medical doctors or have imaging done, like MRIs or X-rays. I work with patients, especially if they're not responding. We want to make sure and rule that kind of stuff out before we continue on with chiropractic care. But 90 to 95% of all pain conditions in the spine are something that we can handle and take care of just nicely. So,
Dr. Owens, I was wondering what causes back pain.
There are many causes of back pain, and that's why you really need a professional to evaluate it. It could be something as simple as a muscle tear, which will heal up all by itself. If that's the case, it goes away in a week or two and never comes back. If it's something more severe, the body generally will tell you. It'll be something that persists. It could be something where the ligament's been damaged, or a bone itself has been jammed out of place, is stuck there, and is compressing onto nerves. And that needs to be evaluated by a professional, especially a chiropractor. But there's many causes of back pain. Everyone, I'm Dr. Owens here at Chiropractic of Bellevue. Today I wanted to go over one of the ways that we can work on someone with low back pain. If we look at the spine here, this would be looking at somebody from behind. I'm going to set the spine down here on the table. Sometimes folks have pain in the side of the lower back, not dead in the middle, but off to the side. And that is pain generated from the SI joint, or sacroiliac joint. And so how we work on that, we have to restore the motion of that joint. And a great tool to use is the arthrostem. And what we do is we just palpate or feel to see which is moving and which is not. And we find the areas that are stuck. And we just want to restore that motion. As we restore the motion, the body then restores that nervous input from the joint up to the brain so that it moves normally and feels a lot better. So that's one of the ways we can work on SI joint pain or low back pain that's off on the side. Have a great day.
Dr. Owens, how do you treat sciatica?
Well, the first thing is you got to figure out where the nerve's irritated at and what's not working correctly. So how you would treat it would depend on what's wrong. The simplicity of it, though, is that as the bones get jammed out of place in the lower back, could be this one, could be this one, it could even be a hip problem down here or a muscle that goes across. We have to free that nerve up and allow it flow down the leg normally and get the pressure off of it so that you can feel better.
Great.